Hey guys, this is Tammy with Nurse Minor. In today's video, we are talking about all the resources you're going to need for lab and clinical, starting with scrubs. So I'm going to give you a list down in the description box below. First of all, let's take a step back. In the description box, you're going to find your shopping list for essentials. And I've done the research on the different types of scrubs available to you, and I have found that there are 5 companies that do really well in terms of nurses' pick for fit, comfort, breathability, washing, wearability in terms of the color not fading. So they're down below. You can do all your shopping at Amazon. You don't even have to go out into the crowds to worry about anything. Let's talk a little bit about the scrub top and what are some of the common things I see students doing and some of the things you want to consider when you're picking out your top. Welcome back. My name is Tammy and this is Nurse Minder, and on this channel we do everything nursing. So if you're new here, consider subscribing below so that you get the next video when it's released. Alright, so you've got your checklist and we are ready to start picking out those things that we want and need for lab and clinical. Now at the very top of the list, of course, is your scrubs. Many of your universities and colleges will be providing you with a particular color that you need to buy or a style, or they will have them at your bookstore for you to get. If you're at the stage where you're allowed to purchase your own, I have a few recommendations for you to make sure you get scrubs that are going to be easy and functional to use, but at the same time fashionable, breathable, and flexible. That's an important one. I have seen many a nurse's butt crack because their scrubs do not fit properly. That's not cool. So go for a nice fit so you can actually move in your shirt. You're going to be doing a lot of patient lifting and moving. You don't want it to be so tight that you're restricted, okay? I personally like a V-neck. I like a short sleeve, although you can get long sleeves. When you're doing patient care, you have to roll it up, okay? I also like a little bit of a fit here, and the split is really nice, okay? When it comes to the pants, pockets are great on both sides. That's awesome, but the most important pockets are here right on the side. This is out of the way of patient care. I can move with it. It's not likely to fall out. And it allows my top to still look professional when I'm coming in to do patient care. Those are my favorite pockets. The second thing you're going to need is a good pair of shoes. Now I happen to like the Saucony company because they have some fun colors and they're really comfortable walking/running shoes. And when you're on your feet all day, you want a lot of great cushion. And these just kind of give a bit of personality. Shoes. Now, if your university or college is recommending that you get white nursing shoes, by all means, I've got a link down below for those slip-on shoes, which are fabulous. I love the slip-on shoe. If you prefer a tie, you can get those as well. Okay, so you're dressed, but there's a few things missing. We need our stethoscope. Now, you're going to want to invest in your stethoscope. Yes, you can get reasonably priced stethoscopes, usually from your bookstore, that are beautiful colors. I will share with you, I find that they do not have the same quality as the Littmann stethoscopes. You will want to get a Littmann stethoscope, okay? A Classic 2 is what I have, but I think they're called Classic 3 now when I look at the comparison, because this one I've had since 2006. Let me tell you, this is an investment piece. No question about it. It will be with you for your entire career. I promise you, you will not regret that decision. The next thing we need to put on is our ID badge. And I'm going to talk to you about why you want to get one of the retractables right here. So as this sits here on my scrub, it doesn't move anywhere. It's attached fairly well, which is great. But every time I need to get into a room, all the access doors are by electronics, and you're always like having to lean forward or take this off to scan. And so that can be kind of annoying sometimes. So my tip is to get the retractables, and there's a lot of great fashionable ones you can get. I got a link below for some really cute ones. And replace this piece with the retractable one. And then you can attach. There we go. And so now when you have to open a door, you can retract your ID out without having to bend over into awkward positions to use your ID. So this is a must. The next thing you're going to want is a quality pen light, because when you go in to assess your patient to make sure that they're not dead, you're going to want to be able to see everything. In addition, you use this pen light to check for pupils, and you want to make sure that even the darkest condition you can see. Did you notice that? My pupils changed shape. I'll do that one more time. I think they've recovered now. You should notice that my pupil has dilated, and that's what you're going to be using your pen light for, as in addition to checking into their IV pumps to make sure that the fluid bags are still full, looking to empty out the Foley bags. You're going to want a pen light that's really bright but focused. All right, so the pen lights can come in different colors. What I would recommend is you get one that is battery powered, and I guess they're all battery powered, my apologies, but one where you can open it up and replace, so a double or a AAA battery that powers your pen light. Now there's some nursing ones that I'm going to pop up here. They also have the benefit of having the different pupil sizes to help you identify the size of your patient's pupils before and after you have shone the light in them. Those are great. If you don't prefer to have that one, you can go ahead and grab just any industrial pen light. This is what I just grabbed at Walmart. Again, I've got links here for you, so you can do all your shopping at home online. Now, in addition to the pen light that you're going to put in your pant pocket, you're also going to need your Bic pen, your 4-color Bic pen. Black is for writing your nursing notes, red is for your allergies and highlights, and blue and green are for just you. You're also going to want a Sharpie so you can mark on your IV bag if you need to, or maybe on the Foley bag, or you've got like a chest tube and you're marking how much fluid is draining. You will need a black Sharpie so you can do that work. We're almost done, but you might notice that something's missing. We need a watch. We absolutely need a watch that has the second hand on it. So you need to be able to see this. You need to be able to see the seconds counting down. And why is that important? Because we have to count people's respirations, and we need to listen to their heart rate, and we need to make sure we're doing it for the right amount of time. So get yourself a good watch. This is waterproof. It's a triathlon, which you don't have to have. It's good for underwater, but you know that I don't have to take it off when I wash my hands because it's fine to get wet. So the other option is to get a lapel watch, and this would just go with your ID, and you would attach it here, and then you don't have to worry about wearing one on your wrist. And so as you look down to do your patient's respirations, you would then look at your watch as you're looking down at their arm. For me, because I wear trifocals, this doesn't work anymore because I can't find the sweet spot to read it. So either one is fine. I do have a link in the description box so that you can pick up a lapel one or a wrist one. All that's left now are the books that we're going to need. So we've got our drug guide, and we have the Merck manual. This is one I recommend to my students all the time. You can actually get this as a free download, as an app. I highly recommend you put this on your phone. You can get the consumer version and the professional version. And what it gives you is layman's terms for a lot of different diseases and tests, and there's videos on different procedures, and it's just a really good quick resource that you can look up when you have a question. Fabulous. I have had this book with me for years, and I took it to every clinical placement I went to. Rather than drag around my big Potter and Perry or my med-surg book, this is the second book you're going to need, is your drug guide. So again, you want to make sure you have the most current year. I'll have the link down below for the Davis drug guide. But again, you can also get this as an app. It is a purchase. You can get a 30-day free, I believe. So make sure you get the 30-day free right before your 1-month clinical. And then if you find it really valuable, you can keep that for a little bit longer. I've never gotten rid of it. It's been on my phone for years. Now, many places are requiring that you change your scrubs before you leave. And so let's just go back to my street clothes for a second. What I wanted to share with you is that Nurse Minder does have a line of clothing, and the messaging is all around how we work together. So we have the Stronger Together messaging and the Make It a Great Day. Both of these are to recognize that nursing is a profession that requires that we lean on each other and that we stand up to stop bullying. So if you'd like to get your Nurse Minder merch, check the link below. It's in the description box where you can pick up your clothing as well. Until next time, guys, make it a great day.